relating to headspace.
The member for Bass.
Mr Deputy Speaker, I move the motion relating to headspace in the terms on which it appears in the notice paper.
The member for Bass.
More than 75% of mental health issues develop before the age of 25. However, many traditional services aren't equipped to address the unique barriers that young people face in accessing mental health support. Headspace began in 2006 to address this critical gap by providing tailored and holistic mental health support for 12 to 25-year-olds. We know that youth mental health is especially important, and early intervention is the key to minimising lifelong impact. Most ongoing health conditions begin before the age of 25, and there are also many life pressures for young people as they make the transition to adulthood. Today, more than ever, these formative years can be confusing and difficult, and many young people find it hard to cope. And though mental health challenges do not always progress to suicidal thoughts or suicide, Tasmania has one of the highest rates of youth suicide in the country, which is something that so many in our community across public, private and community sectors are working hard to address. In northern Tasmania, Headspace in Launceston has been a constant and extremely necessary service since it opened its doors. I am a long-time advocate for increased mental health services for our region, and I'm proud of the government's record in supporting this much-needed service. With a focus on early intervention, Headspace works with young people to provide healthcare and advice at a crucial time in their lives, to help get them back on track and to build resilience for the future. At the heart of Headspace centres is ensuring that young people can access expert health workers in a safe, confidential and youth-friendly environment. Like all Headspace centres across the country, my local Headspace offers young northern Tasmanians support for mental health with clinical professionals that provide support and treatment plans for a variety of mental health concerns. Physical and sexual health, and many centres have on-site GPs who provide judgment-free medical advice and treatment. Alcohol and other drugs, Headspace has alcohol and drug counsellors who work to address the complexities of alcohol and drug issues. Counsellors and vocational workers are also available to assist with a range of life skills such as managing workloads, dealing with stress, preparing job applications and career planning. Many of these services are funded via Medicare, and in addition, Headspace also offers e-Headspace services, work and study programs and Headspace Schools, a national workforce that supports, engages and partners with education and health sectors across Australia to build mental health literacy. Over the last decade, the federal government has provided significant funding for Headspace Launceston to assist with the facilities and staff needed to meet the ever-increasing demand for mental health services. I appreciate the government's willingness to listen to the needs on the ground in my electorate and to respond accordingly. Just last year, we committed $630,000 to Headspace Launceston to meet that growing demand from young people through the provision of extra clinical services, such as structured psychological interventions, group interventions, family counselling and clinics. Specifically, the funding allowed for an additional clinical psychologist and a project officer, much needed roles within the organisation. And just yesterday, Minister Hunt and Minister Colbeck announced that Headspace Launceston will receive $1.567 million to undertake major refurbishments and expansion of the current site. This will create 5 additional consulting rooms, 2 family rooms, a group room and a lift for improved access to the second floor, increased group therapy and brief intervention clinic services, as well as extra student and GP registrar places. From my regular discussions with Headspace, I know this funding is needed more than ever. Between the 1st of April last year and the 31st of May this year, Headspace Launceston provided services for over 1,100 young Tasmanians, which for 485 of these visitors, it was their first time engaging with the organisation. As mentioned previously, the demand for services is ever increasing, and I understand that pre-COVID wait times were lengthy, and while there has been a drop, Headspace Launceston is predicting its waitlist will increase again. I am committed to working with them and our government to continue to provide the funding needed to ensure our young people have access to the support that they need.